This is our first episode on this series where I'm going to talk to you about why we should pay attention to our mouth. How is our oral health affecting our overall health? And then on the following episodes, I'm going to break down to you how you can make subtle changes to improve your overall health and your oral health. First, let's do a quick check together. Do your gums ever bleed when you brush or floss? Does your breath stay bad even after brushing? Are your gums looking thin or pulling away from your teeth? Do you ever feel a metallic taste or see pink in the sink? If you answered yes to even one of those questions, your oral health needs attention. But here's the good news. Most early problems are reversible if you start looking after yourself before they escalate. I'm excited to share that over the next 3 weeks, we're going to transform the way you think about your mouth and your health. Today, you will discover why your gums and teeth are much more than targets for toothpaste commercials. You'll learn about gum disease, bleeding gums, bad breath, and yes, the powerful secret world of microbiome living in your mouth. Stick around because your overall health is on the line too. And trust me, at the end of this series, you never look at your toothbrush the same way. Oh, and don't you forget, hit the subscribe button, set the bell, and get ready as we review facts and solutions that could change your life. We drop new episodes every Monday, so if you want the inside scoop on home treatments and myth busting, make sure you stick with us for all 3 parts of this series. I'm Dr. Maria Florou, and for over 25 years, I've dedicated my career to dentistry, not just as a profession, but as a mission to help people transform their health from the inside out. My passion is integrative, holistic, science-based dentistry, combining the latest research with deep respect for the body's natural healing ability, always seeing the mouth as the gateway to the whole body wellness. I'm proud to be an active member of the International Academy of Oral Medicine and Toxicology and the American Academy of Oral Systemic Health and the Australian Dental Association. These organizations keep me at the forefront of science, connecting with dental and the toxicity that it impacts the overall well-being. Whether you're new to holistic dentistry or already part of our community, my goal here is to provide you with honest, evidence-based information you can actually use. Why is oral health so important? Imagine this. You're sitting across from your loved one, sharing a meal, laughing, living in the moment, or doing whatever you love doing the most. Imagine that. Don't you want to prolong life? Don't you want to have more of those moments? So how about thinking of biohacking yourself and improving your overall health with simple day-to-day habits? When most people think about their health and longevity, being there for those moments, they often focus on diet, exercise, or heart health. How often do we connect those moments, that sense of security, to the humble act of brushing our teeth or caring for our gums? Most don't. Yet, more and more science tells us that connection is real and potentially life-changing. Let's dig deep into why oral health is so much more than just a bright smile. Before we proceed with this episode, I'm going to share something very close to my heart. Recently, both my brother and one of my sisters faced life-changing diagnoses. My brother is having treatment for lung cancer, and my sister for leukemia. Before either of them could begin their cancer treatment, something unexpected happened. The specialist who focused on curing cancer told them both, before we proceed with any treatment, you must see your dentist. And more specifically, seek out any hidden infections or unresolved dental treatments. Why? Why is this so important? Because when your body is compromised and dealing with treatments for cancer or chemotherapy, if we have any hidden infection in the body is compromised and it doesn't have the same capacity for healing to happen. So this isn't just a rare request. It's now best practice in many cancer centers worldwide. A silent infection underneath a seamlessly healthy tooth, especially an infected root canal or pocket of chronic gum disease, can flare up during cancer treatment and cause devastating complications. These infections aren't always painful or obvious, as most people might think, but the risks when your immune system is weakened are enormous. Delayed or interrupted cancer treatment, great risks for life-threatening sepsis, increased overall inflammation that can harm your body's ability to fight cancer. A 2024 clinical study evaluated cancer patients about to begin cancer treatments who also had infected root canals. The results were compelling. Using advanced root canal therapy and specifically focus on eliminating bacteria thoroughly through cleaning and applying certain medications like calcium hydroxide was highly effective to reducing the bacterial load. Why does this matter? Because even low levels of oral bacteria, especially in the presence of apical periodontitis, which means that infected root that we don't feel anything because it's just so embedded within the bone, can enter the bloodstream and it can be dangerous to anyone, but especially to people with immune compromised conditions. Another recent review highlighted the staggering prevalence of hidden infected root canals in some Western countries and often associated with pain-free, previously root canal treated teeth. I'm just saying this to you because we need to look deeper into those things. A lot of root canals are successful when we see a lot of good long-term results, but some of them are compromised and they need to be checked. So what is it all about? Mouth infections, root canal, gum disease are all relevant to our immune response, not just in cancer patients, but to every single one of us. First, long-term oral infections, even when they're not causing symptoms, release bacterial toxins. A lot of other bacteria commonly seen in root canal infected teeth and gum disease have been found in breast cancer tissues and shown to activate inflammation, reduce anti-tumor immunity, and even promote tumor progression. Some other bacteria have been linked to oral cancer risk and chronic low-level systemic inflammation across several body systems. Most importantly, the thing that I want you to take from this first part of our first episode on this series is that chronic infection promotes oxidative stress, and that state releases a lot of free radicals that the body is having to deal day in and day out, and that can cause damage to our DNA, and we become more prone to develop systemic issues and certain diseases. That's why for some patients, it's really, really important for us to focus on minimizing the bacterial load and implementing better practices for mouth care. That makes a big difference in overall health, and we can't undermine the importance of all this. When my brother and my sister sat in the dental chair, we had to review every tooth and have a look at how the gums were going and also the oral microbiome. What we were doing, we were checking for any silent infection or anything that wasn't very obvious that could still be affecting the recovery and the treatment that they carried on with. So once they had the all clear, they went back to the oncologist and they started their treatment. So I'm just sharing this very personal story with you because it's what happened in my family. And I was glad that their oncologist actually brought that to the table and asked them. They didn't think, or the oncologist didn't even know that they had a sibling who is a dentist. But the first thing that they've asked before starting any treatment was to make sure that the oral cavity, the oral health was in good check. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. So what's my advice to you? If you're facing any chronic disease, or if you have anyone in your family or anyone that you care about that's facing cancer or other treatments, I strongly recommend to organize an appointment and see an integrative doctor, an integrative dentist, and have things under control and have the oral health checked so we can interact with the rest of the body and help in a faster recovery, minimizing potential damages. So, protecting your mouth is one of the most powerful proactive steps you can take for total health, especially when life throws you its big challenges. Remember, we don't have to fear our bacteria, but we must be wise about where they can hide and how they influence our body's healing capacity. For far too long, dentistry and general medicine stood apart, but extensive research now clearly demonstrates that the mouth is a mirror to what's happening in the rest of the body and that we interact as a whole system. Now, I want to highlight to you the importance of having healthy gums. What the studies are showing is that there is an estimate of 20 to 30% higher risk of developing heart problems if you have gum disease. One large-scale review study showed that actually once we decrease the inflammation in the mouth, the inflammatory markers in the body also decrease. And those inflammatory markers are connected to a lot of diseases like heart disease and strokes. A meta-analysis included 200,000 participants found that healthy gums were associated with a reduced risk of heart problems and improved blood vessel function. Losing just a few teeth may double your risk of heart problems. The other very important thing to bring into account here is the risk of diabetes of people that already have the diagnosis of diabetes. Gum disease and diabetes have a two-way relationship. Gum inflammation can worsen insulin resistance, making blood sugar harder to control. Controversially, people with poor controlled diabetes are more likely to develop gum disease. And another study showed that people with gum disease had a fourfold higher risk of kidney-related complications. Why am I bringing all this to you? Because even if you're not facing any of those systemic problems, if you're perfectly healthy, I want to make sure that you understand the importance of what's happening in your mouth and how that relates to the rest of your body. Because sticking around and watching these episodes, it's going to bring you the understanding of how to look after yourself and why you should do it. And not just for you, but for the people that you care about. The other important thing that we normally overlook is that the health of the mother's gums can shape the future of the baby. Pregnant women with gum disease are up to 7 times more likely to have a premature birth or a low birth weight baby. In a landmark study, women who received periodontal care during pregnancy reduced their risk of preterm birth by nearly a third. One other very important consideration is when we think of respiratory issues, things like asthma and lung problems, or even pneumonia, especially in older patients. What we see is that these bacteria really interact with our respiratory tract. And it is interesting because we are so closely related. We think about mouth and we think about digestion, but our upper airways start where our mouth finishes, or we could say even start on our lips for patients who breathe through the mouth. Neurological problems, so for nerve problems and for the brain, there is a lot of study and a lot of emerging research showing that oral health also appears related to brain health. Certain gum bacteria have been identified in the brain tissue of people with Alzheimer's disease, suggesting a link between gum disease and Alzheimer's. So what is the real prevalence? Why is this so important? Did you know that about a third of adults present with some form of gum disease? Some people don't have the obvious mobile teeth and bleeding all the time, but that hidden bacteria is still there. And that's why this conversation is so important. Gum disease begins painlessly and progresses slowly, meaning subtle symptoms like bleeding, swelling, or bad breath are brushed off as normal, but pink in the sink is never normal. In one 10-year study, individuals with severe periodontitis were twice as likely to have a stroke compared with those with healthy gums. So, what is the link between oral health and longevity? It's not just about disease, it's about how long and how well you live. Researchers have documented that people who keep the natural teeth into old age live longer and with better quality of life. Tooth loss is associated not only with difficulty eating and malnutrition, but also with increased rates of loneliness, depression, and social withdrawal. So, can you imagine yourself growing old and not knowing any of this? Imagine how your life would be. But now you have this power in your hands and you know this information. You have the information that maybe your parents or your grandparents didn't have. And you can change this today. So stick around and watch this episode and our next part 2 and part 3 of this series to know what you can do at home and with natural, inexpensive treatments that you can do to prevent things from getting to that scale. So, what is an important takeaway from here? 1, all this is preventable. 2, understand the prevalence. That's a real problem nowadays. If you think that 1/3 of the adult population presents with some gum disease, we know that we can stop this right now. Just to give you an idea, oral disease costs the global economy nearly 450 billion per year in direct or indirect expenses. And all this can be preventable. So why is this happening? Here is the critical part. Gum disease and poor oral health are mainly preventable. And why are the statistics so stubborn? One reason is our modern diet. Highly processed foods, added sugars, and acidic drinks encourage the growth of harmful oral bacteria, leading to cavities and inflammation. Stress and lifestyle is another reason. Higher stress means lower immune function, sometimes less attention to personal health, including the basics like brushing and flossing. Intergenerational transmission. The bacteria that cause cavities and gum disease are contagious, shared among families, partners, and even through shared utensils and close contact. So, did you know that your mouth is home to more than 700 species of bacteria? Most help us, but given poor nutrition, low salivary flow, bad habits, we see a lot of the bad guys growing and they can take over. So mostly we want to see good bacteria, but depending on how we feed ourselves and how we look after ourselves, the bad pathogenic bacteria can take control of the environment. The balance or the imbalance of this oral microbiome can tip the scale towards health or disease. When inflammation becomes chronic, these bacteria can enter the bloodstream, and nowadays we know that can enter the nervous system as well. And over time, the repeated exposure of these bacteria and the byproducts that they release are linked to problems in arteries, immune dysfunction, systemic inflammation, and all the things that we have already discussed. Before I continue, I'm going to link on the comments the oral care tools that I recommend you get before we get to our second and third episode, where I'm going to go through in details what you can do at home and the ideal oral care routine. So feel free to check that and have yourself ready as I'm going to show you how to use them and what will be the best routine for you to prevent these problems from happening. Now, take a moment to imagine, what if caring for your gums meant you could age with more vitality, protect your heart, and reduce your risk for dementia? What if helping your child build great brushing habits meant protecting their future, not just from cavities, but from possibly chronic diseases for decades down the line? How many of us have elderly parents, partners, or children who sometimes skip oral care? How many families have shared that secret? Embarrassment over bad breath or missing teeth. It doesn't just affect confidence, it woves into our relationships, self-esteem, and daily joys. Here is a fact to share at your next family meal. Families that care for their teeth together not only have fewer cavities, but healthier hearts, stronger immune systems, and, believe it or not, more active social lives. I hope this is a wake-up call for you or for those who need this advice. Oral health isn't just a dental issue, it's a life issue. Our mouths are gateways to nourishing our body, sharing affection, communicating with loved ones, and so much more. Every time you brush or floss, you're not just protecting your teeth, you're investing in your future and the future of those who you care most about. This is not about fear, it's about empowerment. And this is the reason that brought me here today, is to empower you to make better choices for yourself. Simple daily steps, awareness, and a little prevention can change your health trajectory forever. As we move through this series, remember, the mouth isn't separate from the rest of the body. It's one of the most important parts of whole body wellness, longevity, and happiness. Now that you understand how crucial your oral health is, not just for you, but also for those you love, get ready. In our next segment, we'll look at how gum disease can sneak up on anyone, often without warning, and what you can do to catch it early. And remember, your questions and stories drive this community. So leave a comment with your top oral health concern. So in our next episode, we're going to talk about the role of your saliva, probiotics, sauna, and a lot of other natural treatments, even daylight, sunlight, and how that impacts your oral and overall health. But for now, what I want to do is I want to bust some myths and some beliefs that you may have that are not helping you keep good oral and overall health. So let's dispel a few misconceptions. Some people say to me, if I brush, I have nothing to fear. While brushing is crucial, microbiome health is about more than cleaning. It's about nurturing a robust ecosystem. Overusing some mouthwashes or antibiotics can actually harm beneficial players, leaving you more exposed and not less. The other thing that I hear a lot is bad breath is only about what you eat. In fact, persistent halitosis or bad breath is often a microbiome signature, sometimes signaling deeper imbalances that need real attention. Another myth that you may believe in is that microbiome or the bacteria don't really change. That's absolutely not truth. And I believe you could gather that from what we've spoken about in this episode. You really need to be intentional on how you look after these good bacteria in your mouth. So let's keep it simple. Simplicity, consistency, and science-based practices are your best bet for a long-term healthy journey. Share with the people you love. Share the knowledge that you learned from this episode. So thank you for watching this episode. I know that there was a lot of information packed here for you, a lot of data, a lot of science on this episode, but I want to keep you well informed and motivated to look after yourself. On our next 3 episodes, I'm going to break down for you how to implement changes and why you should be adopting each one of the changes that I'm going to recommend to you. So until then, look after yourself. Look down the comments below if you want to get ready for those next episodes. I have some links on where you can find the tools that I recommend you have to improve your oral health. Until then, take care, and we see you on the next episode. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.